Hey, it's Dr. Jonathan Rubenstein. I want to talk about coding for a procedure that most people know as the Optilume BPH procedure, but is officially titled cystourethropy with anterior prostate commissurotomy using a non-drug coated balloon catheter, followed by therapeutic drug delivery into the prostate by a drug coated balloon catheter. The procedure, therefore, is known as the Optilume BPH procedure. Nuances and correct coding, so let's get to it. First of all, what is Optilume BPH? Well, it is a special dual balloon catheter procedure for treatment of men with obstructive BPH. And in this procedure, two balloons are used. The first balloon is a non-drug coated balloon, which is used to perform an anterior prostatic commissurotomy, which is where the balloon is inflated in a way that actually breaks the anterior capsule of the prostate. This is then followed by a second drug coated balloon that's used to prevent prostate closure, as this drug-coated balloon has an anti-proliferative drug coating. The drug gets into the prostate itself to help keep the prostate open. The most important thing about this is that there is a procedure for urethral strictures, which was our traditional Optilume device and Optilume procedure. But that is a single balloon and it's used for urethral strictures. So it's really important that when this is being used for BPH, that the correct balloon is used so that the correct reporting can be done to make sure that everything is reimbursed appropriately. Now, there was a category 3 code 0619T, which described this procedure. But category 3 codes are for emerging technologies. When a technology has enough use and meets certain what's called category 1 criteria, it's then eligible to get a category 1 code from the American Medical Association. And so this procedure achieved category 1 status, and the code will become active on January 1st, 2026. This code 52443 not only is a category 1 code that shows it's no longer an emerging technology, but it also includes updated language that really clarifies the effort and work that is done for this procedure, which includes the initial balloon dilation to perform the anterior prostate commissurotomy, the use of a drug-coated balloon to help maintain the prostate being open, and any imaging and associated procedures that are done this procedure. So the descriptor itself specifically reads 52443, cystourethropy with initial transurethral anterior prostate commissurotomy using a non-drug coated balloon catheter, followed by therapeutic drug delivery into the prostate by a drug-coated balloon catheter, including transrectal ultrasound and fluoroscopy when performed. And there's an entire list of codes to not be reported because they are included in the procedure. And that includes things like cystoscopy, meatal dilation, would not use it by when somebody's performing a urolift. Don't do it at the same time as a transurethral resection of the prostate or any imaging that's performed. It also makes sure that the Optilume for urethral strictures, which is reported using CPT code 52284, and there's a parenthetical that helps guide a coder to make sure that 52284 is reported when the traditional Optilume for urethral strictures is being performed, not this procedure, which is the Optilume BPH procedure. Balloons, different procedures. So a clinical example of 52443 would be a 75-year-old man who has worsening obstructive symptoms due to BPH and has failed medical therapy, has a 50-gram prostate, and he chose to undergo this procedure as described. So the procedure itself includes all of these steps. The patient's identified, consented, brought to the operating room, placed under anesthesia, put in the dorsal orthotic position, given the antibiotics, prepped and draped, and a timeout is called. A transrectal ultrasound probe is inserted to evaluate the prostate, such as looking at the size of the prostate, the length, the height, and volume, which then can allow the selection of the appropriate size balloon to be used. The non-drug coated pre-dilation catheters passed transurethral, transurethral tracked using fluoroscopy until it's appropriately positioned in the prostatic urethra. Cystoscopy is performed next to the catheter, and the balloon may be adjusted so that it's at the appropriate position, proximal to the external sphincter. The prostate is then dilated using the inflation device, and there's traction that's maintained to make sure the balloon stays at the bladder neck. This inflation is continued until the anterior commissure is separated. So after this dilation, the non-drug coated balloon is removed and cystoscopy is again performed to confirm the adequate anterior commissurotomy. Then the appropriate size drug-eluting balloon catheter is placed into the channel and left in place to allow hydration of the drug coating for a minute. The balloon is then inflated for at least 5 minutes to allow the drug to penetrate off of the balloon and into the interstitium of the prostate. After this drug delivery is complete, the therapeutic catheter is removed and a drainage catheter is placed into the bladder. And again, please do not confuse the two different drug-coated balloons. They have very similar names, and while they have somewhat similar mechanisms, they're completely different procedures using different balloons, and it's important to make sure that the right balloon is used for the right indication and the right CPT code is used to help report the work that's being done. The work RVUs for 52443 in the year 2026 is 3.62 work RVUs. Thank you.